Walking through life feeling like an imposter makes people afraid to try anything new or show that they're trying. They feel like it's a house of cards, and it'll all come tumbling down. We have like a narrative often going on in our mind, sometimes not in our awareness, and certainly unexamined. And it's driving us to behave in certain ways based on that story we're telling ourselves that may or may not be accurate at all. I'm not worthy. I'm sort of like a walking failure, and I don't want anyone to know that. I sat with parents who had a child by suicide, and part of their pain was the shame of this being the way their child died. They deny it. They deny it. And that denial does prevent people from coming in, even people they love dearly, including themselves who they love dearly, because it's too shameful in some way. And can we amend those stories so that they can change behavior? Without self-awareness, you can't change your behaviors.
My voice in today's episode is powered by 11 Labs. Today's conversation is with Dr. Gail Saltz, a psychiatrist, psychoanalyst, author, and one of the rare doctors who has spent much of her career bringing private suffering into public conversation. Her work sits at the intersection of medicine, the mind, family, trauma, secrets, and stigma. She has written about the stories people tell themselves, the damage caused by hidden pain, and the complicated link between difference and strength. This is not a conversation about simple mental health advice. It is about what people hide, what they survive, what shapes them early, and what it costs when suffering is misunderstood. Gail, welcome to the show.
Thank you, Tim, for having me. And also, thank you for spotlighting this, I think, underrepresented material that really affects so many people.
Gail, early in your medical career, you noticed that a patient's fear could affect their recovery. What was the moment that made that impossible for you to ignore?
Actually, before I did my psychiatry residency, I did a residency in internal medicine. And I had a patient who presented to the clinic, and she was a middle-aged woman who didn't know what she had, but basically said, I know there's something very, very wrong, but because there's something clearly very, very wrong, I've been afraid to come in and be seen. And I didn't want to hear some really terrible news, but it's hurting so much now. I had to come. And she turned out to have what's called a fungating breast mass, which means it's like ulcerated and it's very, very, very painful. And it was very large. And it must have been incredibly obvious for some fairly long period of time. And of course, she had breast cancer. Unfortunately, it was so very, very, very advanced at that point that her life expectancy was very short and treatment options were very limited. And I spent time talking with her, and it was just very clear that the fear, when this first presented as something maybe noticeable, was something that she just denied to herself because she felt so panicky about the idea that she could have cancer. And that was just incredible. I mean, it was hard to imagine how somebody could ignore something so very obvious at a certain point, but it just made it very plain to me how powerful the mind can be at controlling your behavior, even in a self-defeating way, in a dangerous way, due to fear and denial. And this was my first very clear example.
And did you see that in other stuff too? Or is it more just, I guess like when my dad was asking about the recovery, my thought was like, that there's a problem and you're fixing it, working on making it better. Are you seeing it on the kind of post-diagnosis and actual trying to get better phase, or is this more of just a denial to come in?
So when I've had numerous patients who presented to me because, frankly, their doctor referred them, because their presentation with the medical problem was something that was so frightening to them that actually it was doing two things. One was it was preventing them from coming to all their appointments and engaging with the treatment plan in the way that it was intended. Two, their physician believed that actually the anticipatory anxiety due to fear that they had each time they came in was making appointments where he or she wanted to communicate what next had to happen in the treatment, how things were going. Sometimes they weren't going well. Very difficult because they could see that this patient was so incredibly fearful. I also, of course, knew from my end that that level of fear was causing them to have issues, everything from, higher blood pressure to more cortisol circulating in their system, causing more inflammation, actually making perhaps the medical problem worse than it already was. And so I understood, even if the referring doctor didn't, that it was very important to help the person with the anxiety that they had around the meaning of this illness and the meaning of the symptoms for them.
It's funny because it's not the same thing, but it's like my dad knew something was wrong when he originally couldn't clip his fingernails, and at that point he was like, he looked like an action figure and was like 240 pounds and lifting weights, and he couldn't cut his fingernails, and just kind of denial, and then tried to get something called you might probably know it as better than me, but an ulnar nerve in his elbow. He had an issue when he was playing, and they thought maybe that was it. So he did surgery on one side, and then which really was like the worst thing you could do for ALS. And then he got the ALS diagnosis, and we did nothing for a full year out of denial, and then started to. So yeah, that one hit home.
Yeah, I'm afraid the most powerful issue is usually denial. I mean, of course, on the other side, there's also, to some degree, helping a patient to maintain hope and investment in the parts of life they can be and hopefully should be partaking of is also, I mean, there have been a lot of studies, right, that have looked at how important it is and what an effect hope. And hope doesn't mean cure. Hope means there are things that I can do each day that I like partaking of that, bring me some measure of happiness or participation, and it's meaningful to me. When you lose that, it negatively affects outcome of a lot of health diagnoses. So helping a patient not be so swamped in fear that they lose hope is another really important task, I would say, of a mental health professional.
That tension between body and mind shaped your path. When you decided to move more deeply into psychiatry, some people saw that as less serious medicine. How did that land with you at the time, and what was your response?
Well, you were right. And that was really, I found that really difficult because I was, doing this residency in internal medicine, and but I knew from the fact that the psychiatrist who came on rounds with we internists once a week to talk about the mental health and inner life and inner world of the patients that we were treating and its bearing on their medical care. When that was clearly the highlight of my week, my fascination with the mind and the brain, I realized that, I needed to make this change in career for myself, for my own feeling of purpose and meaning in my career. But it was really difficult because at that time, the reputation of psychiatrists was sort of quacks and, and not having the same, certainly, what should I say, respectability, prestige as, other types of medical doctors. And so, I had to sort of come to grips with what felt like my own ego and being less respected, on the one hand by others and judged, which I was most certainly judged by, I had a chief resident who said, what are you kidding me? Why would you give this up to do that? So it was very hard for my colleagues to understand that. And at the same time, I felt angry because I was very aware that those feelings and judgments from others came from a very unfair judgment of people who I would be taking care of people with mental illness who were highly, highly stigmatized at the time. And so, it was difficult. It was angering because I saw that this stigma against people who were labeled as a crazy or, something like you would see in a movie, was hurting a huge patient population. And it was even a stigma held, frankly, by other physicians. So I thought that doesn't feel very hopeful to me in terms of trying to manage this and take care of people. But at the end of the day, obviously, it didn't deter me from feeling that the brain is our most important organ. And if you don't have mental health, you don't have health. And that the mysteries of the mind were, to me, far more fascinating. And that we, whether we like it or not, we spend every day trapped in our minds. And the health and well-being of those minds is everything for living and living a joyful or flourishing life.
Was there any criticism that you considered? I mean, obviously, you ended up down your right path for you and all that good stuff, but it all worked out. But was there anything at the time that maybe it was like a family member said something, or there was one thing in particular that you were like, oh, maybe I shouldn't do this?
I think it was really the reaction of my chief resident at the time, who said, I don't understand this. This is really taking, you're intellectually, this is taking a step down for you. And so I can't understand. And he also asked me, don't you think you will miss the joy and the rush of these, procedures? And he named a few procedures that, internists often do in the hospital. Like as if I didn't feel I would miss that, or I didn't find that exhilarating, then something was wrong with me. That, had me take a moment and really question myself. Why don't I feel those feelings about, these particular procedures? And why do I feel this, actually that exact feeling that he was describing about sitting at a patient's bedside and understanding something about their life narrative that brought them to this moment in time, that made them feel the way they feel now, and the permanence of that without intervention. Why did I feel that way? So it did have me go back and really question the decision and question myself. But I spent some time doing that, and I guess at the end of the day, right, I came up with the same answer.
You have spent your career trying to reduce shame around mental illness. Was there a moment when you saw how dangerous this shame could be?
There have been many moments that I have witnessed how dangerous shame about mental illness can be. When I was in my psychiatry residency, I took care of young people, teenagers, whose parents were so mortified by their child's mental illness that it was difficult for them to let them be in the hospital or help them to stay in the hospital, even though their lives were at risk. They were contemplating death by suicide, and it was very important that they stay. And it was clearly embarrassment that their, peers would know that their child was seriously mentally ill. I sat with parents who had a child die by suicide, and part of their pain was the shame of this being the way their child died, not understanding it. Clinical depression is an illness. It's a biological illness. At the time, I think, that this is part of what drives stigma, right? The lack of understanding that these are biological processes. They're illnesses like other biological illnesses. And so feeling that this meant they were a failure as a parent, this meant their child was a failure as a person, and that stigma tortured them. I mean, not that they weren't already tortured by the loss of their child, but it tortured them that much more. I sat with family members where, a patient was psychotic and did some, things that were very embarrassing to them. And they just really could not grapple with that. And again, did not, felt that this was, how were they sort of going to put this person out to pasture so that they didn't have to witness it, that they wouldn't have others witness it. And of course, this left this poor person, the actual patient, feeling alone and feeling rejected and feeling, blamed for their own illness. And that was really, really difficult to see, and, required a lot of effort and time to convince people that, these are illnesses and no one is to blame for these illnesses. And you treat them like other illnesses. And, I would say the other big thing that I have witnessed shame impact is how long it takes parents to bring a child who is struggling with a mental health issue in for treatment. Like on average these days, it's 3 to 5 years between the presentation of the first symptoms and actually walking through a doctor's door and about those symptoms. And that is a long time. That is too long. That is a long time for neurocircuitry to become very rehearsed and embedded, meaning it will take longer to treat that child. It's more difficult. Severity has increased. They've fallen off the developmental curve and lost time that they needed for that development. And it's because of the shame the parent feels and the negative, stigmatized thoughts that they have, like this means my child will never be whatever they imagine. And so it's not that they just say, well, I see it, but I'm not coming in. They deny it. And that denial, just as you mentioned earlier, if you're invested in an identity of being a, incredibly strong and powerful and agile and all of the things about one's body, and then one's body starts to fail one, it can be so uncomfortable and even embarrassing to feel like this feels like a failure somehow, and I can't see this, I can't look. And that does prevent people from coming in, even people they love dearly, including themselves who they love dearly, because it's too shameful in some way. So I really, I've seen this in multiple different ways, and it's not out of lack of love, but unfortunately it has a very, corrosive effect.
I think, like, personally, so I would say I'm asking you more than telling you, but I think personally, like I've got young kids, and I would be so resistant to bringing them in somewhere because I guess two things. One is I feel like you hear the horror stories. I guess there's horror stories both ways, but I wouldn't want like my young children to be prescribed something like a really powerful drug, right? And then the second thing is I've had things with my kids where I've been like, oh, this isn't normal, but it ends up being like a phase, right? I didn't have anything 3 to 5 years, granted, but I don't know. And then you hear like, I don't know, you hear about all these things where kids are now, medicated more. And I don't know if it's like people reporting it more or maybe things are actually, maybe there are higher rates of it.
So, it does, this could be like a whole podcast itself. But what I would say is this. First of all, many things that come up with kids that require treatment, and the definition of required treatment, right, is they have a collection of symptoms that have caused them to regress in some way, right, and not function at the level that they were functioning at. So whether that's in school or whether that's socially or at home, they are unable to do whatever they were doing, and you can see this right distinct change, and it lasts for, I don't mean for a couple weeks, but it lasts for a month or two, that something is distinctly different. And you see that difference is at some level, right, causing them suffering in some way. So whether that's an anxiety variety of suffering or a mood variety of suffering, it's causing them suffering and dysfunction for some extended period of time. And I mean, I'm just lumping it all together as opposed to what is the individual diagnosis. And the truth is that many of the issues that first present in childhood can be treated with a psychotherapy. They don't require medication. It's really a small number, a small percentage that rise to the level of like, we don't diagnose schizophrenia in childhood. It's just not. We're not diagnosing, for the most part, psychotic disorders in childhood. We're talking about kids who have an anxiety disorder of some sort, a mood disorder of some sort, or maybe attention deficit hyperactivity disorder. That's a common one. And if you leave it, right, then they can't participate and accrue the things, right? They're not learning in the classroom. They're not socializing and learning those skills with their friends, and they're miserable, because they know at some level these things are going on. But cognitive behavioral therapies, 8 or 10 sessions, often really treat a child who has a full-on anxiety disorder or a full-on mood disorder. Teaching coping skills for dealing with attention deficit hyperactivity is a great workaround that helps a lot of children struggling, like executive function, organizing skills, without requiring medication. Like, not everything is about medication. So what do I believe? I believe in this country, we have some people being over-medicated because they're getting them probably not from trained professionals, meaning they're getting from another kind of physician who is like, I don't know, take this. They're internist or, a pediatrician, and they're not followed in the way a psychiatrist would. Or they're really, really severely ill, okay, which is unusual. So more often you take them to a psychologist who does, like I said, 8 or 10 sessions, and, it helps them overcome those symptoms, get back on their developmental track, not get more severe, and carry on. That's really what I'm talking about when I'm talking about China. Unfortunately, by the time it's been 3 to 5 years of this, it may be at a very different severity level, and it may require medication.
How would somebody be able to tell if it was, I guess you're just saying if it persists for more than a few weeks, if it's like a phase versus being a full, like, so I'll use like a very personal example, but my daughter, like she had like a really big problem wearing any clothes that like when they would touch her skin, like if she wore like tighter clothes.
Right.
And this lasted for a long time. I mean, maybe a year, And now it's totally, she wears any clothes, no big deal at all. And like we thought about my wife is like, maybe we should take her. And I'm like, no way. This is I'm like your and my brother, by the way, does child family psychology. So like I'm in the minority here, I know, but I'm
Okay.
like, I don't want to, because then in my head, what I was saying is like if you take them to see somebody, then they think something's wrong. And like as a kid, it's like, oh, maybe I have to go see this person because I have something. So what would you suggest to somebody who has, if they have a young kid and they are going through something, like how do you tell if it's a phase or if it's something? And
Right.
I know you're generalizing because you're talking to an unnamed, unseen audience member, but
Right. So, like the particular example you give, right? It is common in childhood for kids to be intermittently very sensitive to tactile or visual or auditory stuff. And the question is, how severe is it? If your child can't put on clothes, so they can't go to school or anywhere else outside in the world, then they might need some help with sensory integration, which, by the way, is not a psychologist per se. It's an occupational therapist. It's not really considered a mental health diagnosis per se. But the point is, your kid put on clothes. Your kid didn't like anything tight or whatever. She might have had some tantrums over certain things. But it didn't really cause a high level of dysfunction, right? So in that sense, you were willing to ride it out. But if at some point it had, I would say to you, anything that causes your kid to have to shrink their world, that's when you've crossed a line. So she can't go play with other kids because clothes. She can't go to school because clothes. She can't think about anything else or turn her attention to anything else because clothes. Then, you need to help her. And, that sensory integration is sort of like about tactile therapy with brushing and so on. It's not drugs. But, and by the way, just because something might eventually resolve of its own doesn't mean you never needed to go. So it's sort of a question of how much is your child suffering? How much is your child missing? And how deleterious will the effect of having missed and suffered for that length of time be more negative than whatever the intervention would have been? Does
I got
that?
the last thing on this subject, and I swear I'll let us move on. Have you ever heard of Leland Vittert?
Yes. I've done his show a number of times. Yes.
Oh, so that's perfect. So somebody like that, and like, how do you balance between those where it's and for anyone who doesn't know, he grew up with autism, and his parents never told him he had autism, and school was very challenging. He talks about it in great detail, and he has an amazing book about it. But his father would every day when he would come home, and they would work on certain almost like rituals or things they could do to handle stress or handle the differences. And his dad focused on getting him to where people were rather than trying to get people to get to where he was. And I guess that's something too that I found like so conflicting with all, again, going back to kind of more focus on child therapy, is like when do you draw the line of, and you said, I actually love that line you just said, like if your world shrinks because of it. But with somebody like Leland, like where he went, like that's like a pretty extreme case, and it worked. Is that just, there's 100 other examples where it didn't work and he just not lucky, but it
Right.
worked out?
Well, his father was essentially doing early intervention, right? Whether he knew it or not. He was working with his kid to expose him and desensitize him and do a lot of the things that a therapist probably would have done with him. But he was doing it in the family, fine. It's not that I'm in love with labels. I actually am not, as a matter of fact, terribly in love with labels. DSM-5 diagnoses and labels are something that, we have to use to talk to insurance companies to get reimbursement. We have to talk to schools who have to provide services for kids who need those services. So their value lies there. the importance of somebody personally owning a label, I don't, it is not, I don't think that's super important at all, actually. And for some, it might not be great, especially if they stigmatize that label, right? But some people today are feeling that actually a relief in getting a label that is an explanation for something they feel they did struggle with and continue to struggle with. And it's relieving to understand why, as opposed to some amorphous, I feel abnormal in my world. So it depends on the person. I will tell you that pretty much all of the research, for example, in autism spectrum is early intervention is everything. And of course, you have to understand that autism is a spectrum. So obviously, he was on the mildest end of the spectrum, probably at a time we would have called that Asperger's syndrome and not autism. But Asperger's, we got rid of that name and we just call everybody somewhere on the spectrum. He would be mildly on the spectrum because something we're probably going to talk about later, but people who have different kinds of mental health issues also have the potential for extraordinary strengths. So he luckily had a parent who did interventions that actually really helped and would be something that a therapist would do. But he also helped his son play to his strengths, which were there. The potential was there. And that created the best outcome. And in that case, whether he carried the label at a time when the label was highly stigmatized, I could argue maybe just as well he did not. But in this day and age where it's less stigmatized and many people are starting to understand how highly functioning someone on the mild end of autism can be, then understanding that is what has made, for example, socializing difficult or, certain things difficult for you might be a relief. I have encountered many patients who felt that way.
From private stigma, you moved into public misunderstanding. In your media career, you spoke about a mother, Andrea Yates, who had killed her children, and you tried to explain postpartum psychosis to the public. In that moment, what were you most afraid people would misunderstand?
So that was a period of time where people had, frankly, never heard of such a thing. In fact, most people hadn't even heard about postpartum depression, very different from now, let alone postpartum psychosis. And so what I was worried about is that people would not understand two things. One is that postpartum psychosis and postpartum, deep depression, these are biological processes and they have a certain set of symptoms and they are distinctly different from most mothers who go through a period and in fact, well into their kids' childhoods, that they may occasionally have a thought of, what if and I said this on air, what if I left my child by the side of the road? And then that thought comes into their mind and then it goes away. And that thought does not mean you have postpartum depression or postpartum psychosis, nor does it mean you're a bad mother. What it means is that all mothers have ambivalence. It doesn't mean they don't love their child dearly and they aren't thrilled to be a mother and they aren't wonderful mothers. It means it's normal to, as your expression of sometimes feeling highly stressed and having not every moment be great, feel, what if this burden was lifted for me? And those thoughts of like, what if I did this with my child or that with my child that isn't good, is really just an expression of that normal ambivalence. And that actually, if a mother could know about her ambivalence inside and accept it as normal, then she'd probably A, have fewer of those thoughts and B, be less disturbed by them. But that it's important to understand that you are not like Andrea Yates if you occasionally, you're having a thought like that. And that was a big moment on the Today Show because it was actually one of the first times I came on. And it might have actually been, I think it was the first time I came on. And I was with Katie Couric, and she said, "Oh my God, I've had a thought like that." And it really freaked me out. And I'm like, right, because every mother at some point has a thought like that. And so that was so valuable. That's what I feared the audience wouldn't know or get. So it was the combination of being able to say it, but also having the host say, "I've had that experience, really." And such a relatable host, And so I felt, and I got a lot of response of relieved women who were like, I have had that thought. It really scared me to death. And to know that's normal and it's common and it doesn't mean anything bad about you or your mothering, but it's distinctly different from the woman who feels distraught most of the day, every day, and has trouble taking care of her child and is plagued by terrible thoughts or thoughts of self-harm, thoughts of harming her baby. That's a psychiatric emergency, and that woman needs psychiatric care. And I also wanted to make the point that being seriously psychiatrically ill and doing something terrible in the throes of truly not having the capacity to understand right from wrong because you are psychotic is incredibly rare, like very, very rare. People who have serious mental illness are far more likely to be victims of crime than perpetrate a crime. Nonetheless, when a psychiatric emergency is spotted, and it wasn't in this case, it's important to separate a baby from her mother and take care of both. And that those signs are spottable usually long before anything happens. And it does not make that person evil. Evil is not psychiatric illness, and psychiatric illness is not evil.
After that appearance, women started writing to you about postpartum depression and psychosis. What did those letters show you that medical school had not?
Well, when you're immersed in medical school and in residency, everybody around you knows all the things. So I was really struck and realized how little the lay public knew about mental illness in general, like very little. So we're now talking about the early 1990s. And I was just very struck that basically what I would call psychoeducation was missing in being transmitted to a lay audience, to people who weren't psychiatrists, and weren't medical doctors. So most people, the letters I got were, I didn't know about this. I thought, oh, I'm just a little emotional after my baby. And they didn't understand that they're what's baby blues, what's postpartum depression, what's postpartum psychosis, what's postpartum mania. People just didn't know about these things. And that opened up a whole, world for me of realizing how important it was to me to spend time talking to non-MDs about everything from, clinical major depression and, that's an illness that you can't just pull yourself up by your bootstraps, which is at the time what a lot of people thought about it, or, various anxiety disorders or panic disorder, or, to understand the biology of these illnesses and the symptoms of these illnesses, and that when something has happened and who to go to and what treatments are, it really, cracked that open in my mind.
You often say stigma keeps people from getting help. What does that look like in real life before anyone calls it stigma?
So originally, right now, when I started doing this kind of public education work, nobody called it stigma, really. It was just this everybody understood the same storyline, which is, medical illness is medical illness, and psychiatric illness is just embarrassing behavior, or somebody of not having strong moral character, or somebody didn't parent them well. There were like a bunch of storylines, through lines that is really sort of what people generally thought, but they certainly experienced it as like, I'd like to either deny it, as we talked about earlier, like denial, that's not really the case, or oh no, this person is like not trying hard enough, and they're messy, and they're, I sort of like, just fix yourself, like just pull it together, man. And so that is often how it presented. And, unfortunately, the history of psychiatric treatment before there actually was any psychiatric treatment were terrible things that we did to people. I mean, like centuries ago, right? We thought they're possessed, so we have to like exorcise them by doing terrible, chaining them up or putting them in ice water or spinning them around until they're unconscious, or shocking them. And I don't mean ECT therapy, which is actually a very good therapy for people with very serious, life-threatening depression. But other forms of doing things that were really more amounted to torture than anything you could say about psychiatric treatment. And so that picture of the past also left people certainly afraid about admitting that you had a problem that you might need treatment for, and left just a very bad like feeling of like yuck over the whole, field. So yeah, I think it labeling it as stigma is sort of a newer, last couple decades phenomenon to understand what all these different feelings about it were.
That public story also becomes a private one. You have written about the stories people tell themselves. What is one story a person can carry for years without realizing that it is controlling them?
So this is really the basis for all talk therapy in a way. The idea that we have like a narrative often going on in our mind, sometimes not in our awareness, and certainly unexamined, that self-talk, and it's driving us to behave in certain ways based on that story we're telling ourselves that may or may not be accurate at all. And so sometimes, for example, someone may have grown up in a home maybe with a lot of criticism and feeling that they didn't live up to whatever the ideals set out in the home were for them. And they may walk around with the storyline in their mind, I'm not worthy. I'm sort of like a walking failure. And I don't want anyone to know that. But in that sense, they may end up doing things that are self-defeating, to basically join with that story, like, for example, they're really being underpaid and they really should be getting a raise, or they should be getting paid more. And they either are like, I will never go speak to my boss about this, self-defeating, or I'm going to go speak to my boss in this way that clearly transmits it's perfectly fine because I don't really deserve this raise. I was thinking about this, I was noticing this, but I know it's a tough time. And, after all, I didn't meet this quotient, whatever. And without really understanding that's what they're doing, they're transmitting an ask for a no. And so when people keep repeating things that are self-defeating, maybe they're choosing a partner who treats them badly, because they deserve that in their minds, because they're really not a good person, or, they're haven't lived up to it in some way. Then then that becomes a self-fulfilling prophecy, right? They keep self-defeating, and then they feel worse and worse, and then they really don't deserve anything. And so this is the kind of person who comes into my office and says, I don't know why I feel so miserable, and never get to that next place or the next thing or the better partner. And we try to unpack that and understand what are the stories, where did they come from, are they fair, or are they really a story they've just held on to for a long time, and they're not really based on past realities. And can we amend those stories so that they can change behavior? That, in a nutshell, is sort of how talk therapy works. But so, yes, as a psychoanalyst, I see a lot of that. And there are different kinds of stories that cause different kinds of behaviors. But without self-awareness, you can't change your behaviors.
One version of that story is being strong. When someone has built their whole life around being the strong one, what usually breaks first?
Well, if sort of rigidly holding an idea of being the strong one also often includes sort of in a perfect way, like a pretty rigid, like I'm only strong. And nobody can be only strong about all things at all times. And so it makes it very hard for someone to have help ever, ask for help ever, be willing to accept help ever. And so what breaks first? Sometimes relationships, because everybody in a relationship needs to be needed, in addition to, it's sort of like a mutual caretaking situation, but being needed is part of it. So if a partner is like, I can never accept your help or make you feel needed, that can harm actually the relationship, particularly when it's evident that it is needed. That's certainly, that's one of the first things I think about. But also, well, obviously their self-image can really suffer if their feeling of positivity about themselves is so rigidly based in this, whatever strong means to them, which may not be everything that actually strong means. Because strong can mean a lot of things, right? It can mean physically strong, it can be mentally strong, it can be resilient. It could be, there are a lot of ways to be strong. So it's sort of like, how rigid is their variety of strong? Can it be flexible enough? And if it can't, then I think usually the person suffers. Same sort of sufferings people do who have a lot of perfectionism. And anything that deviates feels like a crushing blow. It feels very all or nothing, like they're strong or they're weak. And that can cause a lot of suffering of mood, a lot of anxiety.
When that identity becomes performance, secrets start carrying weight. You wrote about people living secret lives. What happens inside a person when they have to keep pretending every day?
Well, walking through life feeling like an imposter makes people afraid to try anything new or show that they're trying, because they're anticipating failure, and so they don't want to be spotted as an imposter. They feel like it's a house of cards, and then it'll all come tumbling down. So it's very, very limiting in what they attempt, something new, something difficult. It makes it difficult for them to be vulnerable in any sort of way, which really affects intimacy. You can't be really, really intimate with someone if you can't be vulnerable. It makes it difficult to trust others, which also impacts one's ability to be intimate. And in certain instances, it may drive them to do things that are not good for them in trying to cover up their secret. So that could be anything from, just a self-defeating behavior, and amoral behaviors, criminal behaviors. It depends on the nature of the secret, but it certainly does drive one to do things that probably, are not healthy and not ideal for their best lives either, and not great for the people around them.
Have you ever seen a secret protect someone for a while but eventually destroy them?
Oh yes, often. In fact, that's my reasoning for understanding your secret and working to have it become not a secret. But I would say probably the most common scenario for that is the person who is cheating on their spouse. It could be emotional infidelity or, also physical infidelity. But initially, they think it's helping them because they think they're unhappy. They're unhappy in their relationship, and that if they could find something else or someone else, it will make them happy. And maybe initially it does even make them happy. But ultimately, when, that's how you leave and you've accrued the next person by cheating on the first person, you've started this relationship with all kinds of problems with trust. You often I see that the person who did this is incredibly destroyed because they actually don't want to lose their spouse when it's uncovered, and they want to stay in the marriage and they want forgiveness, but it's, sometimes the spouse is able to forgive them, but the spouse is never able to forget, and it doesn't go back really to the way it was. And then, of course, most of the time the marriage ends, and that also destroys the person who was living this secret affair. And the person who they started with is not the person they want to be with, and they are alone and they are unhappy, and they are unhappy with what they've done with the family and with the kids, and they miss the spouse. That's probably a very common scenario I see.
Like if you were talking to somebody in that where they're still in the lie, where they're using the lie to protect them, what's like the advice you give people like that?
Right. I really try to tell them, you're not thinking about where this is going to go. What's the good outcome? Since, the reality is ultimately it's highly unlikely you can maintain the situation as it is today. Highly unlikely. And whether it's because you're found out or because you have feelings and there are two other people with feelings, and you're going to feel more in love with somebody than the other somebody, or whatever it may be. Either way, once you've chosen to, let's say, love two people, and polygamy is not legal and is not going to be the case here, you're going to have loss. You're going to have loss, but you won't be able to control what the loss is. So living in this state of impending loss looks great because you're not thinking about that. You're not thinking about that. And the other loss you will have is, looking yourself in the mirror and feeling good about yourself.
You have studied high achievers and public figures. When does ambition become a hiding place? And do you have a favorite example of someone you have studied?
So I think that ambition that is sort of purely narcissistically driven often is the person inside feels sort of tortured. And because if they're not a superstar at all times, and they're not, defining themselves as a very obvious super high achiever, then they feel like nothing. They feel like nothing. And so they are, rather than confronting with themselves with whatever vulnerabilities they have, whatever, human qualities they have of being real and not, a cardboard cutout of some, godlike figure, they find that impossible, really, without feeling, total loss. And so they reside in that place of just trying to stay and feeling that they have to see it, that they're staying in that high achievement position all the time, which of course isn't necessarily possible. So they're often teetering on the edge of feeling like, it could all be taken away at any moment. And that's a tough place to reside. In terms of favorite person that I've studied, well, I really, really have loved the look back at Vincent van Gogh. And he, of course, was not known to be a high achiever during his time. He is, one of the greatest artists of all time, but he suffered mightily. He struggled always. And he probably had temporal lobe epilepsy, which is, the symptoms of that are more psychiatric than other forms of epilepsy. You don't have like seizures in the same way. It affects, because where it is in the temporal lobe, it affects mood and visual abilities, and emotion being laced with other things that go on in your brain in a very dramatic and hyperbole way. And so I think what's really fascinating to me about studying Van Gogh is that that the symptoms of temporal lobe epilepsy explain a lot of choices that he may have made in his paintings about color, about representation, and about form. So on the one hand, unbelievable, like incredible and cool. And on the other hand, obviously, it caused him terrible suffering, particularly in an arena that he clearly wanted so badly, because he often wrote about it, to bond with others. He wanted so much, and he felt so lonely. And his sort of hyper emotionality made it very difficult. He was often irascible and irritable and what's called sticky. Like he would really attach himself to someone and then argue with them. And those were probably also symptoms of temporal lobe epilepsy, for which, nobody really had a great treatment for at that time, pre-medication. So it's a very fascinating story, but it really makes you think a lot about the representation of suffering in his art, but also the form and the beauty and the evocative nature of it, which probably had a lot to do with his illness.
Your book, The Power of Different, argues that struggles come with real strengths. When have you seen that idea misunderstood or taken too far?
I wrote about this because it's true, because the research, and this is what I tried to present, is the research that shows the neurocircuitry that is affected with various mental health issues, and that same neurocircuitry is part and parcel of the potential for these extraordinary strengths. Meaning that people with certain symptom clusters that we call a mental illness are more likely to be, in some instances, highly creative or highly innovative or have a very particular ability, more so than people who do not have a mental illness. And that's very important to understand. But what I feared people would misunderstand, and I tried, therefore, to be very clear in the book about as well, is that I'm not saying mental illness, what a gift. because it's not a gift. It is very difficult. It causes a lot of struggle. It causes a lot of suffering. And it is very important to get intervention and to get early intervention to mitigate as much of the suffering as you can, but it's not necessarily all of it. It's very, it is more difficult to go through life with a mental illness. There is no question about it. But that is separate from the issue that there are also potential incredible strengths that you may possess. And that what's important is to understand what those strengths may be and how you can best play to those strengths so that you have the most ability to succeed in certain arenas. And that helps mitigate self-esteem, even as you may be struggling with a mental illness, which will be affected by that mental illness. So, for example, had Vincent van Gogh understood, and we all understood that he had this illness, but that it gave him the potential for these incredible strengths, he might have suffered a lot less in understanding that he was producing incredible works of art. Unfortunately, that, he did not get that message at that time, and we never talked about that at that time. And these studies are more recent studies that have come to light. So, but I don't want people to think that I am saying or misunderstand that mental illness is a gift. That would be incorrect. Oh, and I will say one other thing, that mental illness needs to be treated. So it's also a misunderstanding that you should keep the mental illness so that you can keep the ability. That's not true. Treatment does not diminish that potential ability. That's very important.
That same boundary starts early for some children. You talk about children who are more sensitive, like orchids rather than dandelions. What do parents often miss about a child like that?
I think the reason that I do talk about the orchid versus dandelion concept is just that there are children who are sensitive and probably need extra nurturing, extra attention, extra encouragement, because they are very sensitive or they have some, issues that are difficult to manage, but that does not equal difficult child, bad child, child who's never going to amount to too much. And I think therein becomes this unfortunate label that a parent will often think about a child. And then that becomes the self-fulfilling prophecy. You even if it's just internal, labeling your child as like, oh, they're just a difficult kid. It's, there's nothing I can do. They get that feeling and then they fulfill that prophecy for you. As opposed to saying, okay, my child is more sensitive. My child has more needs. And that actually really nurturing them through that, attending to that, getting them help if they need some help, is what allows them to manifest these potential strengths I spoke about earlier and become really, flourishing, like uber flourishing.
You have warned against overprotecting children. What is something parents do out of love that can quietly make the child less resilient?
Well, this is a big issue now because, we've come out of a period of a lot of helicopter parenting, parents feeling like parenting is a competitive sport where they just have to, do everything to, their child should be successful all the time, right? And not fall down and not make mistakes, get all gold stars and a trophy for everything. And unfortunately, the reality is that resilience, which if I could offer you one thing as a human being that you would have that would help you in your stead through life, it would be resilience. Because sooner or later, life throws you curveballs. And, it's what you do with those that really determine how life is going to turn out for you. So the only way to build resilience is actually to have difficulty and struggle and make a mistake and fall down and then figure out how to get back up, how to make your way through, not how to fix it like it never happened, but how to just keep going, even if it's hard, even if it's sad, even if there's loss, not deny it, but process it, learn some lessons from it, come out the other side of it in some way, and carry on, if you will, because that's where you learn. I have this inner strength. I can do this. It doesn't have to turn out great. It's not the end of the world. I have this ability, and I managed. And that is what builds resilience, so that, later stuff happens and you look back and you go, well, I made it through that. I'll make it through this. That is essentially what resilience is in a nutshell. So parents who are doing their kids' homework and reports and talking to the teacher if the kid didn't get the grade they wanted, or, all of this is not teaching them the skills to be resilient, they're not getting to own the things that they did well, and they're not getting to own the things they didn't do well and learn from that too. And they're not prepared to go out and be sturdy adults who, with all of life has to throw at you. So yeah, that's the problem.
Are there places where, so again, me having young kids, it's so hard not to helicopter. I have to like almost physically force myself to do it. But are there places where you can get, I hate to say this, but almost like more bang for your buck, where you can let them, or it's like, let them fail, let them, like, school when they're this age, like my kids are young enough that the grades just don't matter at all. And so there's not really like I remember being in whatever later elementary school or early middle school and like not doing something and being like, oh crap, I hope my dad helps me write this paper. And sometimes he would help me, and sometimes he'd be like, no, you knew the deadline. Good luck.
Yes.
How do you, I mean, what's like the balance there? And is there like a high ROI thing where kids get to experience the tough life lessons without?
Yeah, look, I mean, obviously, you don't want them to fail at something when there's any danger involved, right? You don't want to be like, oh, you thought it was a good idea to walk home from the mall in the middle of the night. No. You don't, when it
Sure.
comes to whatever, what should I say? Alcohol, drugs, dangerous situations, like high stakes, that's not where I would go, well, they'll learn a lesson. But beyond that, like, if they're going to be like leaving the nest and they're teenagers and they have no idea how to do their laundry, and you're like, if you don't do your laundry, you're not going to have any clean clothes, and they wear smelly clothes, and everybody said, what the hell's wrong with you? I think they'll learn how to do their laundry. If you're doing all the things for them, right? They don't need to learn them, but I think the line is, the problem is, see, the age your kids are, if you don't teach them that it is their responsibility, then by the time they hit the time where it is high stakes, like maybe they want to go to college and this grade does matter, or their SAT matters, they will not have already incorporated that, like you're going to bail them out, right? You're going to smooth it over in some way. So starting early is better. It is better. It's not that you can't undo it later, but it's harder. It's harder to undo it later. And I would say, obviously, nothing with safety or like really high stakes. So you got to stop yourself and say, what are the really high stakes here? If my kid gets a C on this book report in middle school, what is the really high stake there?
For parents trying to practice that restraint, what would you suggest for a parent with young kids to make sure they are not doing that?
It unfortunately takes a lot of self-honesty on the part of the parent. One, like being honest with yourself. Two, it takes the parent recognizing that while the child might feel like a narcissistic extension of themselves, the child, really your goal for them is that they not be, right? Your goal for every parent really should wish, and probably does wish at some level, that their child would grow up and be an independent, own person, successful in their own right, finding happiness and flourishing in their own right, finding their own relationships, and not just be a trophy for the parent or an extension of, like, I get my pride from what my kid does in life. So you have to hold on to the other things that you find sources of pride from, and not just your child. You have to allow them to be human and be honest with yourself about allowing that. And you have to really buy into what I'm saying. You have to buy into the reality that actually you are undermining your child's development. You are undermining the possibility that they get to feel like a confident, capable, they really can do it adult. And so, they may have all A's and they may go to the best college, but sooner or later, they're going to arrive at a place where you can't do everything, and they are not going to feel able, and they will not, and they secretly don't feel that real confidence and capability. So you have to, I guess, buy into the argument I'm making.
That brings us from family pain to political cruelty. In your work with human rights and trauma, was there a case or a moment that stayed with you more than you expected?
The cases of psychological torture, which happen around the world, and individual cases that I've been involved with, because they are purposely perpetrated with the knowledge that they leave no visible scars, and that the world's still believing, if I can't see the scar or the illness, maybe it's not real. And so the ability for organized groups to, I guess what I'll say is, get away with psychological torture is frightening, and that really stayed with me. Makes care of those victims much more difficult, because they also doubt, were they tortured? They doubt themselves, which is terrible, and makes taking care of them very, very difficult, and makes recovery very, very difficult, and makes the world less supportive of victims of those kinds of human rights abuse. And so that really profoundly affected me and continues to affect me, that, people who are trying to escape a regime where, the point is to be, in bright light 24/7 and denied sleep and denied care, and told every other minute you're going to be executed, and told your family is being killed, and told, psychologically tortured. Really, really, in some ways, those wounds and those scars are more difficult than the physical ones.
You've spent so much time helping people name pain. Has there been a kind of pain that even you found hard to put into words?
Well, admittedly, my job requires me to help people put pain into words. So I probably have more words than most people in talking about pain and suffering. But I guess I will say the pain of loss, of losing someone you love um, is is sometimes words feel insufficient. I guess that's what I'll say. It's like a visceral feeling. And, there is a biology to this too, that, grief at a certain level um, is also biologic, and that psychic pain can feel a lot like physical pain in some ways. So that mixture of just feeling like you're in so much psychological pain that your body hurts, or you feel it. People will say, "I really feel it in my gut," or "really feel it in my chest." That it's hard to have a word that really encompasses how deeply terrible that feels. I think that loss of somebody that you love deeply, that you love so deeply, is hard to put into words.
You have been both a private doctor and a public voice. What has public attention cost you personally?
Some years ago, sometimes doing public work would affect a treatment somewhat. I mean, I would always try to work through it with a patient, but they would have a lot of thoughts about what it meant that I did that public work, and it could, a little interfere or distract from, what the patient really came in for, was struggling with. But I think, I worked very hard to, you know, redirect that or analyze that or understand that in a way that it would, be as little interfering as possible. Um, and then, of course, I think there's just the realities of us sometimes being more public in general. Years ago, I had a stalker, which was a very, very frightening and terrible experience. I mean, obviously, directly because of my public work, and by somebody who clearly was, very obviously very, very psychiatrically ill, but, you know, would come to my office and write threatening letters and try to show up at a public event where I was speaking and I'd have security. It was scary. And I'm afraid that unfortunately public work sometimes can lead to that. But mostly, to be honest, I feel super grateful for my public career. It's been mostly a wonderful thing. I love treating patients. When you treat patients, you treat one person at a time. And when I speak to the public, I often get feedback from many people about, how something really resonated with them, how it changed their mind about something, how it made them think about getting treatment, how they're asking me for a referral for treatment. So I feel like it really grew my capacity to be helpful in this field, exponentially. And that's really gratifying.
When you're doing your I guess your job, and then you come home to your family, is it hard to kind of turn it off? Because I can imagine, parents, like my dad was literally a first round NFL draft pick, college football Hall of Fame, and I thought I knew football better than him when I was whatever, like 14. He would tell me to do things. I'd be like, you don't know that. I can't imagine, like, in your career is so much more personal than sports. Is it hard to kind of turn that off, or no?
I think I'm very well aware that you can't be your own doctor. You can't be your own psychiatrist. You can't be your own psychotherapist, and you can't be your family members' doctors or psychiatrists or psychotherapists. So that's sort of like part of training. And so I've really tried. I wouldn't say I've never struggled with it. I have. But I've really always tried to remind myself, I'm not the right person for this aspect of the job. And just try to remember always that I'm, you know, wife, mom, and come from that angle.
A lot of your work is about helping people see themselves more honestly. What part of yourself has been hardest for you to see clearly?
Well, actually, to your point earlier, I think it has been hard for me to, if I've missed something or I'm not sort of spot on in my understanding of the emotional life of one of my children or my husband, um, and therefore I had what I would call some, blinders on at some point. Um, that is hard for me because it affects me both personally, as feeling like I'm an empathetic mother and wife, but also professionally because I'm like I should have, I should be able to see that. But I think that the very for the very reason that you are the mother or you are the wife is why you might not see it because it's too close. It's so close that sometimes you don't see. But I think that would definitely be the hardest for me.
Before we close, I always ask our guests to brag about their family for a minute. Gail, please go ahead.
Wow. Wow. It is not hard for me to brag about my family. I have a wonderful marriage, and it's been 37 years, so I am incredibly blessed. And that is partially because my husband is a incredibly wonderful man, a physician, who I admire and respect and adore and my greatest supporter. So I feel I'm just incredibly lucky, and and I have three incredible daughters who are now all adults, and they have all worked really, really hard, of which I am proud, to pursue their three varied careers, and I'm very proud of them for doing that. And I think they're each in careers that they find a lot of purpose and meaning in. I'm very happy about that, and they, they're adults making their own mistakes and decisions, and but basically, doing adulting in a good and positive way that in many ways that they've chosen give something back to the world, which I also do feel is important. So I'm very I'm a lucky woman, and I know that every day.
I have found a lot of strength through faith in Jesus, and I am always interested in how others think about it. In your own life, when has faith felt closest and when has it felt hardest?
Wow, this is a hard question for me. I was actually raised in a home with no religion and no faith, and I think that's difficult to acquire later in life. I'm just being really honest. And I'm very aware of the deep well of research that shows all of the sort of advantages, if you will, of having faith. The people with medical illnesses do better, those with faith, and well, a lot of things. There are a lot of difficult things in life in which faith buffers and soothes and comforts and is just is a big positive. um, I have a belief that there is something more than us, but I don't have a defined, specific what is that. So admittedly I'm a very science-based person, um, and I do believe that there's probably some greater power, and because everything is, it's hard to imagine the way things are that there isn't something more. But what specifically that is, I could not tell you. I guess that would make me sort of agnostic in faith. Um, and I think sometimes that's very hard. That's hard for me because I would love to feel that there is a power that I could turn to, if you would. And I think that would be a big, big plus in life. But I think, you have to come by it honestly. You have to come by it yourself. And so the result is, I feel, um, you know, very reliant on myself and those I love, like completely. And I accept that there are things that are just really out of my control and out of anybody's control. And that is difficult, but necessary.
Now, on to our final word segment, where we ask our guests a few rapid fire questions. What was the happiest moment in your life?
I don't know how I would choose between the birth of each of my babies, but I suppose that it would be, maybe to someone that's going to sound crazy because it's very painful, but the birth of my babies, like I just felt joy like no other joy, like unbelievably joyful. The day I got married and my babies.
What is the biggest adversity you've faced?
I guess one big adversity is I found out at age 50 that I have a cancer-causing gene, which was a total shock to me and meant that I had to have a bunch of surgeries and I had to be monitored in a certain way, and I had to live with the knowledge that I have this gene and I have this risk, and maybe some of my kids do too.
What are you most excited about?
Definitely there are future work opportunities that I am very excited about, but I guess I would say to some degree it's watching my kids take their next milestone, whatever that is. So for example, one of my kids is married and has a kid, and so like I became a grandma, and that was super exciting and super joyful, and I suspect there will be more to come. And I'm really excited for the sort of future generations and my interactions with them.
What advice would you give your younger self?
There would definitely be some form of stop sweating the small stuff. I really was a highly, highly anxious, very, very driven, but super anxious young person, driven by, feeling that I needed to achieve and I wanted to achieve. And I sweat a lot of small things, which, there's a famous quote, but basically, I worried about a lot of stuff that never happened. And that's the nature of worry. And so I would love to have told my younger self to either have intervention about that or, find a way to worry a whole lot less about the many things that were never going to happen.
Do you have any book recommendations for us or for the listeners?
Well, I have to say that my last book, which you referenced, The Power of Different, The Link Between Disorder and Genius, of my books, I would recommend that one because I think that it's a window into the issue of stigma and destigmatizing. But I also think that everybody either has or loves somebody with a mental health struggle. And this will just shed a different light on the way that you see that. And I do think that is a very worthwhile read for most people.
The name of our podcast is Nothing Left Unsaid. Do you have anything you want to say?
Well, I'm feeling pretty admirous of this whole setup, of this whole situation, of what you've created here. It's pretty impressive and cool, and it sort of screams resilience, if you ask me. So I think it screams personal resilience, it screams family resilience, and so I just would like to say that.
Yeah, thank you. All right, real last question, and then we'll let you go. At the end of every episode, we always ask our guests, who are a couple of people that you know personally, now that they got to know us a little bit and know about the show, who are a couple of guests you think we should have on for future episodes?
I I think of people that I don't know if you can have on, but you know, because of who they are. You know, I mean, I think I can think of celebrity people that I think would make like cool personal guests because they've championed the way, particularly for women, like women comedians, Julia Louise-Dreyfus would be like an amazing person. I think, I mean, I think there are some, like, I think Atul Gawande would be like great, like killer person. Um, uh, you know, he really profoundly and philosophically is able to talk about medicine in such a meaningful way. Um, yeah, I don't know.
Gail, thank you for joining us. Your work asks people to look more honestly at suffering, shame, secrecy, difference, and the stories that quietly shape a life. These are not abstract issues. They affect families, patients, children, and people who may be hurting in ways no one can see. We appreciate your time, your clarity, and your willingness to speak about these things directly. May God bless you and your family.
Thank you. Thank you.
Yeah, thanks so much.